Hi, my name is Dr. Ian Jackson, and I'm a board certified family medicine physician. I've been practicing in Southwest Michigan for about 7 years and wanted to share some information and concerns about the upcoming Proposition 3 that's on the ballot for November 1st. It's titled the Reproductive Freedom for All Initiative, and while it may seem to be addressing abortion access in Michigan, it actually goes far beyond that. Um, the proposition is not long. It's 323 words, but it says a lot. And the language is vague, subjective, and undefined in a lot of ways, which leads to the concerns. So let's dig into this a little bit. First of all, there's no stipulation for age nor parental consent with Proposition 3. So that means children, minors, could seek and obtain care related to reproductive health, which includes pregnancy care, but also abortion, contraception, and sterilization. And they can do that without a requirement for parental consent. I think those are heavy things that all of us parents would want to speak into as our kids think through that as they mature. But that is not protected for in Proposition 3. There's something like 41 laws in Michigan that regulate or restrict abortion to some extent, and those include um, penalties for late-term abortions, requirements for caring for or protecting babies born during abortion, and even prohibitions on using taxpayer-funded Medicaid dollars for abortions. But all that, in essence, goes away if Proposition 3 passes, because there's a stipulation that says if any law conflicts with Proposition 3, it's null and void, essentially. It does say that the state may regulate abortions performed after the point of fetal viability, but that is left up to the judgment of the healthcare professional. And so, in essence, an abortion could be performed at any point in pregnancy up until the time of birth if Proposition 3 passes. And there's no guidance for who can perform an abortion. So currently, only licensed physicians in Michigan can perform an abortion, but I don't think we even know where this could take us as far as who could be trained or allowed to perform abortions and what that kind of training would look like. So that's not even all the concerns with this proposal, um, but it's enough. And no matter what your stance on abortion is, we should not allow something that is so subjective and vague to be codified into the Michigan Constitution.